Greetings from Hello. My name is Ivana Matić and I am ENT specialist from ENT Department General Hospital Dr. Josip Benčević, Slavonski Brod, Croatia. My topic is change in body weight, body fat and body water in children after tonsilloadenoidectomy. Indication for tonsillectomy are absolute indications in adults and in children, which include sore throat caused by tonsillitis, which meets the following condition: 5 or more episodes of sore throat per year, or tonsillitis which is diagnostically confirmed by one of the following criteria: positive swab on BHSA, purulent exudate on the tonsils, body temperature higher than or equal to 38 degrees, lymphadenitis of the neck with at least one node larger than 2 cm, complication of tonsillitis such as peritonsillar abscess and sepsis, permanent airway obstruction, obstructive sleep apnea syndrome, suspected malignant process in tonsils. Of the conditions considered as relative indication for tonsillectomy, ISCR guidelines suggest occlusion disorders and chronic tonsillitis, which is defined as a condition in which the patient suffers from chronic sore throat and bad breath, and the above symptoms do not decrease within 1 year of their onset. Tonsillectomy is an ancient surgical method and one of the most common surgical procedures used in ENT worldwide. Complication after tonsillectomy can be main or other complications. Main complications are hemorrhage, which can be primary or secondary, and pain. Other complications are dysphagia, dehydration, weight loss, vocal changes, and anesthetic. It is well known that unlike the majority of operative procedures that are usually associated with the suturing and primary healing of the wounds, after tonsillectomy the wound heals secondary, which is caused more pain. Exposure of the submucosa brings pain by irritating the sensory termination, exposed dependent on the lingual and glossopharyngeal nerves. It is very often poorly tolerated, leading to the weight loss in the immediate postoperative period from decreased oral food intake resulting by the sore throat. According to the study of Smith and al., tonsilloadenoidectomy performed for OSA or recurrent tonsillitis has been associated with weight gain after surgery, but not in the early postoperative period. This study suggests that this weight gain is variable and age-dependent, with children 6 years and younger more likely to gain weight after surgery than children older than 6 years. There were previous studies that investigate the role of tonsilloadenoidectomy in weight gain in children. One of them was a study of the Dutch birth cohort that found correlation between tonsilloadectomy made in children between 1 and 7 years resulted in overweight or obesity by age 8. Most of the studies made direct correlation between weight gain and tonsilloadenoidectomy. Study made by Rosicki investigate the weight loss in adult tonsillectomies and showed that they lost roughly 5 pounds after tonsillectomy, with subsequent return to normal weight after 5 months. They associated this with poorly tolerated of tonsillectomy in an adult population, leading to decreased oral intake compared with children. According to Conlon, children receiving tonsillectomies were likely to have pre- and postoperative weight exceeding the national average. Children in a similar postoperative period as adults gain weight, but do not do so faster than individuals that match them by age and sex. It is most likely that in the early postoperative period after tonsillectomy, odynophagia and dysphagia are important factors that cause decrease of oral food intake and consequently weight loss. According to the Laurel, for assessing dehydration, the gold standard is percentage of body weight loss. Low body weight is a risk factor for dehydration and following complication after tonsillectomy when compared with children of greater body weight. The objective of this study is to assess what was the cause of the weight loss in the children in early postoperative period after tonsilloadenoidectomy. Prospective study included 31 patients aged from 6 to 22 years treated at Department of ENT, head and neck surgery in General Hospital Dr. Josip Benčević, Slavonski Brod, Croatia, from January 2017 until August 2017. There were 16 male and 15 female. 18 of them were less than 10 years old and 13 of them were age 11 and older. The study was approved by the Hospital Ethics Committee and has been performed in accordance with ethical standards laid down in the 1964 Declaration of Helsinki. All study subjects and their parents read the study protocol and provided their written informed consent for the inclusion in the study. Informed consent was obtained for experimentation with human subjects. All the patients underwent tonsilloadenoidectomy by two surgeons with cold knife method. Post-operatively, regular analgesic therapy was administered. Analgesic therapy was initiated at first 1 hour after waking up from general anesthesia. Patient received paracetamol IV 15 mg per kilogram every 6 hours. Pain assessment was done by use of visual analog scale every 2 hours during post-operative period. The results of the pain assessment and administrated analgesic therapy, post-operative complication, and inception of eating were recorded in a specially designed questionnaire, as you can see here. Patients were discharged to home care on postoperative day 1. During the next 7 postoperative days, patients were required to enter the use of analgesics, paracetamol syrup, 50 mg per kilogram, maximum daily 60 mg per kilogram, according to VAS scale. 1 is mild pain through 10 most severe pain. They were suggested to take analgesic when pain exceeded note 3. During the study, children were weighted before tonsillectomy, 24 hours after tonsillectomy, 7th postoperative day. Weighing was performed by the body structure analyzer BC 420 MA Tanita. They were looking at age, height, weight, body fat, body mass index, muscle mass, and body water were recorded. The results of the measurements and evaluation of the fat tissue in the body was automatically recorded by the structure analyzer Tanita. There are distribution of the mass, body fat, body mass index, muscle mass, and body water by the age. And here is post-tonsillectomy pain evaluation. The results of our study show that mass changes is significantly related to changes in the body water and changes of the muscle mass. Changes in the body fat is significantly related with changes in the body water. In a group of the children up to 10 years old, mass changes is significantly related to changes in the body water and the changes of the muscle mass. change in the body fat is related with changes in the body water. But in the group of the children aged 11 years and older, show that mass changes are significantly related only with changes of the muscle mass, while there was no significant correlation among other values. Water is an important factor of muscle mass. It plays an essential role in the muscle repair and growth, since it's crucial for protein synthesis. Poorly hydrated muscle loses its weight, since cells don't have enough water in themselves. Protein synthesis can be delayed, and muscle tissue might jumpstart catabolism. In conclusion, we can say that good hydration, especially among children up to 10 years old, in early post-tonsilloadenoidectomy period is important, because with good rehydration, the children will not lose the weight of the muscular mass, and which is showed by the result of our study. Thank you for listening to my presentation.